Hello, welcome back to the Project Nourish podcast. You're listening to episode 9. We're your hosts. I'm Megan Gump, a certified nutritional therapy practitioner and Restart instructor.
And I'm Casey Poe Campbell, also a nutritional therapy practitioner, licensed esthetician, and Restart instructor as well. We're here to bring you a podcast all about health, wellness, holistic nutrition, functional medicine, and non-toxic living.
As a disclaimer, topics discussed and recommendations given in this podcast are not to treat or cure any disease. We as NTPs want to discover and address your underlying health symptoms using nutritional therapy and functional medicine.
Well, hello, friend. How is your week going and your day?
Hi, friend. Hi. Week is going great. I just love Wednesdays because I work from home and then we record our podcast. So it's just such a great day for me. And earlier I went to the chiropractor to get my shoulder tweaked out from what I did to it last week. So that's getting a lot better, which is good. How was your day?
Yeah, I meant to ask you how your shoulder was feeling.
Yeah, it's a lot better. I still haven't done anything upper body whatsoever. So I've been pretty big lazy bum, but it's getting better. So I'm excited about that. And I'm just going to chill out on it for about another week and then get back in the gym. So I'm excited for that. I've been doing I've just been doing like resistance band stuff, nothing super crazy, just moving it. So it'll be good once I can get back at it.
Very cool.
Mm-hmm. What's up with you?
Let's see. Well, it's snowing here in Colorado, one of those fabulous springtime snows. So the other day, this was really funny. It snowed again, and it was again one of those like super heavy snows. So I went to turn on my windshield wipers, and the blade just went flying off. So I had to drive to work without my windshield wiper. So it turns out you really need those things.
Yeah.
Things you are not grateful for until you do not have them. So the lesson for the day was be grateful for your windshield wipers.
Yes. Yeah. I feel your pain because mine have started to like not give out, but I guess they just get old. So the point of contact between the windshield wiper and your windshield gets like real, wavy and on and off. And so if it's like raining or muddy or something, you've got this like streak right in front of your face and you're just like, man, I need new windshield wipers. So I can only imagine how it is when the whole entire thing falls off.
Yeah. So, but luckily they are fixed.
Good.
So Mr. Campbell hooked me up.
Good.
Yes.
That's what those boys are good for.
Exactly. So what are you digging this week? Anything new and fun?
Yes. So what I'm digging this week is the Four Sigmatic mushroom coffee.
Dude, that's what I'm drinking right now.
Yeah.
So good.
My brother Bryce was in town from Colombia this weekend and he ordered some off Amazon because we've all been hearing about it and he really wanted to try some. And so I was like, ooh, cool. Like, and I had some and I made like a fatty coffee with it and it was super, super good. So I'm digging that right now.
Mm-hmm. Yeah, it's so good.
Yeah. What about you?
So I actually have two things that I am digging. Right before we started recording, Amazon delivered. So the first one is this book called Wine Snob. And my dear friend who is a master sommelier, Melissa Monosoff, wrote this book. So super cool that I have a friend who is a master sommelier and has a published book on Amazon. Like it's hardcover and everything. So
that's
next time
awesome.
I go fix this, Melissa, I'm going to have you sign my book. And then the other thing I got, so I keep seeing these, they're jade rollers. And so what you do is you use it on your skin and you just like press down and like roll your skin and you do like upward motion and it's supposed to help with stimulates the meridian flow to tone and improve skin elasticity and revitalizes your chi for a more radiant, youthful appearance. So next week, I'll probably look like 5 years younger.
You'll be glowing.
Yeah. So what I plan on doing is actually putting on one of the, like either the Countermatch Intense Moisture Serum or maybe the Radiance Rejuvenating Serum, or maybe just getting crazy and mixing them both together. That way I get the vitamin C along with that hyaluronic acid to put it in there and really like make it go deeper into my skin.
That's really
So
cool. That's a really
I'm
good idea.
I'm pretty psyched about it. We'll see. Next week you might not even recognize me.
I know. Oh my gosh. You're gonna have to call me and let me know how you're loving
Yeah,
it.
I will. I'll probably do multiple Instagram stories on it. So
I'm sure you will.
yes.
I'll be in the loop. Cool. Well, that thing sounds awesome. I might want to try one.
Yeah, I'm pretty excited. I'll let you
Yeah.
know.
Okay. Sounds good. All right. So today, you guys, we are going to be talking about SIBO, also known as small intestine bacteria overgrowth. So, SIBO is basically just an accumulation of bacteria in the small intestine that is overgrown, right? So, our small intestine has like a normal level of this bacteria that live in our GI tract. But when SIBO occurs, when these normal bacterias have abnormally overgrown in a location not meant for so many bacteria, right? Because our large intestine is where a lot of our bacteria hangs out, a lot of our microorganisms. And when they creep up into the small intestine in large amounts, this is where it can cause problems. So, a big thing with SIBO or small intestine bacteria overgrowth is it is actually it is one of the main causes of IBS. So 60% of IBS is actually from SIBO. So people are being diagnosed with irritable bowel syndrome, and it's actually because they have small intestine overgrowth, bacterial overgrowth. And people are just not aware, so they're being diagnosed with IBS, and they are going to the doctors and they're getting prescribed, different medications and antibiotics, and they don't know what to do or how to control it, and it's really just an issue with this bacteria being overgrown in their small intestine, which is something that is totally treatable, totally reversible, and can be dealt with. So if you've got IBS, turn this up. This
Yeah,
one's for
exactly.
you.
I mean, it's just one of those things, like another example of just putting a Band-Aid over something
Right.
instead of really trying to find the root cause of what's going on.
Yeah. Yeah. So, so the main symptoms of SIBO are those of IBS. They're pretty much the same symptoms, but there are also many, many causes for IBS. One from poor chewing. Right. Casey and I talked a lot about that in digestion. We talked about that again in podcast after digestion as well. Chewing your food is just so freaking important. And so IBS is from poor chewing, but also all the way up to cancer, and everything in between. You can get IBS.
Yeah, that's just crazy. So, some of the symptoms of IBS, you can have abdominal bloating, aka gas, belching, flatulence. I always love that word.
I know.
Fancy word.
We can also
Abdominal
say
pain, cramps, constipation, diarrhea, both. Other symptoms could be heartburn, reflux, or GERD, also nausea. And then also, you can have some leaky gut. And so, some of those symptoms of leaky gut could be food sensitivities, headaches, joint pain, fatigue, skin symptoms. So, seeing eczema or rashes. This one, I always find this one so interesting. The respiratory symptoms, such as asthma, definitely, something that you wouldn't think would be gut related at all. And then these other ones too. So mood symptoms such as depression, and then brain symptoms such as autism. All of these can go back to your gut, which, people just don't relate the two.
Yeah. And one thing about these like leaky gut symptoms, because you have to keep in mind, it's like leaky small intestine, right? So a lot of our nutrients are absorbed in our small intestine. So when we're not properly absorbing the nutrients that we need, like our vitamin D, A, K, our B vitamins, B vitamins are involved in the methylation cycle, so they make our energy. Just everything that we eat, when these organisms are basically robbing us of our nutrients, that's when it causes a lot of issues down the pipe. So we aren't properly making the hormones that we need for our adrenals, for our thyroid, for the rest of our body. But as well, same thing with like our neurotransmitters. So you talk about serotonin, dopamine. That's where people get these mood symptoms with, depression, anxiety, stress, all that kind of stuff. Same thing with like the skin symptoms Casey mentioned. You got to keep in mind that if you've got an overgrowth of bacteria or candida or H. pylori, that's where a lot of the times people are going to get eczema or rashes or psoriasis or all of these other skin conditions, is actually because they have a gut infection, because there is an overgrowth in their gut. So really something to keep in mind, if these are, you and you've got some of these symptoms, if you're tired all the time or your joints just hurt or you've got food sensitivities that you can't explain, you really need to look deeper into doing some sort of, stool test or breath test to figure out, okay, what's going on, because there is an underlying root cause.
Yeah, definitely. And going back to the skin issues, I mean, you just think about it. When something is actually coming up onto our skin, I almost consider it kind of like your body's like 911. Like there is something, it is your body's kind of last cry for help. Like, okay, dude, there is something major going on when stuff starts showing up on your skin.
Yeah, 100%. And I don't know if anyone out there has ever seen the diagram, but there's a diagram out there of our face and how all the different areas of our face pertain to different organs in our body. So a lot of times if you're breaking out like on your cheeks or your chin or your neck, it's pertaining to like your liver, your kidneys, or these other areas and organs of, your body.
Mm-hmm.
So it kind of gives you an area to focus on. But yeah, I mean, same thing with just anything. And you got to keep in mind too, small intestine bacterial overgrowth or even small intestine fungal overgrowth. So a lot of people will get like fungus on their fingernails or their toenails. Their nails will actually be like yellow or having like some sort of like yeast overgrowth. I mean, you can tell there's like a yeast problem. Same thing with like the mouth. So if your tongue is white or you've got like a white ring around your lips, that is a really good indication that there's an overgrowth in your gut, right? Expressing itself through your mouth. Same thing with your hair. If you've got like a dry scalp or kind of like that dandruffy thing, that's typically can be from like a yeast bacteria overgrowth. And then also for a lot of women, I know UTIs are like vaginal infections. So if you've got a UTI that just will not freaking go away and you keep taking antibiotics and medications and that sucker just comes back right when you get done, you for sure need to look into small intestine bacterial overgrowth or candida or H. pylori or some other infection in the gut that is causing that to just keep coming back. Like you need to address up the pipe the root cause of the issue beyond just taking medications and antibiotics or doing like douches and other kind of things like that, because there's a bigger issue.
Mm-hmm.
So yeah, our skin is our largest organ. When we see stuff going on in our skin, whether it's our hair, our mouth, our fingernails, toenails, other areas of the body, then you really gotta think about what's going on inside.
Yeah, that is when it's time to call your nutritional therapy practitioner, your functional medicine practitioner.
Yeah,
for sure.
Yeah, for sure. So I know a couple, like Casey was mentioning symptoms, and I kind of mentioned like the malabsorption symptoms, but they can be beyond just like nutritional. So you can also get like fatty stools. So if you see like a lot of mucus or fat in your stools, that's something to be cautious of. Anemia, so iron, B12, B6, copper, I mean, you name it, pretty much any nutritional deficiency. Iron's a really big one because there's a lot of people when they have a bacterial overgrowth, iron or their ferritin is actually one of the things to get really low super quick. So you want to look into those levels with a blood test. You can get that done by your doctor. And if you have a ferritin under 50, you want your ferritin to be about 50. So if you're touching down to that 30 or 16 range or even lower, you've really got to look into what's going on that's in your gut that's absorbing your iron. So
real quick, I just wanted to, in case people don't know what a fatty stool looks like, it's when your poop is floating and it appears kind of like greasy or pale and it is abnormally foul smelling.
Thank you for that.
Just in case. We haven't done a poop episode yet, which we
which we totally are.
yes. So that is what we mean when you have a fatty poo.
Yeah. Yeah. So good description, Casey. Thank you.
Hey, no problem.
So a couple of the issues with SIBO is the bacteria interfere with our normal digestion, right? So the absorption of our food, but they're also associated with the damage to the lining or membrane of the small intestine. So talk about leaky gut syndrome. This is what they can do to really mess with the integrity of that lining. And then kind of what I was talking about with malabsorption. So they also consume some of our food, which over time leads to deficiencies in our nutrients such as iron, B12, which can cause anemia, right? So we explain this. And then they also consume food unable to be absorbed due to the small intestinal lining damage. So this continues the overgrowth, which is just a vicious cycle of these organisms consuming our food. We've got malabsorption. We have nutrient deficiencies. They're absorbing our food. Our intestinal lining is damaged. And then it's just this whole system of the bugs eating our food. We're malabsorbed. Our intestinal lining is damaged. You know, we eat more food and so on.
Such a sad cycle.
Sad.
Yeah.
And it's, yeah.
So after eating our food, they produce gas and expel flatulence within our small intestine. And so this gas is going to cause abdominal bloating, abdominal pain, constipation, diarrhea, or both. So these are going to be the symptoms of IBS. And the excess gas can also cause belching and flatulence. They decrease proper absorption or proper fat absorption by deconjugating bile, which can lead to deficiencies of vitamins A and D, so some of our fat-soluble vitamins, and lead to fatty stools, which we now know what they look like and everything. And then through the damaged lining, those larger food particles not able to be fully digested can enter into the body and into the bloodstream. And at this point, the immune system is going to react to these guys. They are just put on like panic alert, like, oh my gosh, we have gangsters in the neighborhood, like what's going on? And so this can cause those food allergies and sensitivities. And some of these worst cases are actually going to lead to autoimmune diseases. So I think it was Chalene Johnson came up with such a great analogy for leaky gut, like what it looks like so people can imagine. So if you imagine a pair of like brand new Lululemon yoga pants, just like how nice they are and just like how they hold everything in versus a pair of like, that's what our gut should look like versus a pair of fishnet stockings, like that's leaky gut.
Oh my gosh.
So isn't that so great? Like yay, Chalene Johnson for coming up with that fabulous little analogy there. So you want Lululemon pants, not fishnet stockings.
Yeah, that's pretty perfect.
Yes. So then the bacteria themselves, they can actually enter into the body and the bloodstream, and the immune system reaction to the bacteria and their cell walls, an endotoxin, can cause chronic fatigue and body pain and burden the liver, which I think we've talked about this before, that everyone should just hug their livers because they perform like 500 functions at least that we know of.
Yeah.
Yes.
Yeah, Casey. So right there, you just mentioned how people get the fatigue and the joint pain, the body pain, the brain fog. Yeah.
Yeah. And then finally, the bacteria excrete acids, which may in high amounts lead to neurological and cognitive symptoms. So again, going back to the depression and anxiety, things that you would never really associate with your gut health until you listen to us.
Yeah. Yeah, that's crazy. It's just so nuts how, we all naturally have bacteria in our gut, but depending on how we live our lives and the environment we're exposed to and the foods we eat and the water we drink and the toxins that we're exposed to totally determines the balance of these bacterias and which ones are able to thrive and which ones basically their, populations are downsized. And these guys just cause they control everything in our body. Like our gut is our second brain, and there's more of these bacterias than the cells in our body, which is pretty freaking crazy. And they control, the way that we make our hormones, our neurotransmitters, our thought process, our mood, how we're tired, how our joints feel, how our brain works. And so it's really important to address these guys. If you have any of these symptoms going on and you think that you just have IBS, or you're just tired all the time, or whatever's going on, I mean, you really got to look at like parasites, bacterial overgrowth, H. pylori, candida. You got to look for the underlying cause because it's there.
Mm-hmm. All right, so Megan, now that we know the signs and symptoms to look for, how do we go about treating SIBO?
Yes. So there's a couple different ways to treat SIBO. So the first thing that you want to do is you want to do a breath test to find out if you've got the methane type of SIBO or hydrogen. So you do a 3-hour lactulose breath test. So you're basically drinking a liquid, and the way that these bacteria process the liver, you either get methane or the hydrogen. So that's, what the breath test is about, to figure out which type it is. And then based on the type that you have, then we can kind of determine, all right, this is how treatment needs to go. Because there's a couple different routes that you can go based on what type you have. You just want to make sure that you're using the appropriate herbal supplements and protocols to make sure that you can eradicate these overpopulations of these bacteria.
Yeah, so this is definitely something you don't want to do on your own. Like, again, put your NTP on speed dial.
Exactly. Yeah.
Don't self-medicate on these ones.
Yeah. I mean, our goal is to definitely educate everyone about the symptoms and different diets and the treatment protocols that are used, but you also want to implement all of this information with a nutritional therapy practitioner or a functional medicine practitioner. Mm-hmm. So this is, even us, Casey and I, as NTPs, we can't be our own practitioners. We always have to turn to someone else, because someone else is going to be in a different set of shoes, and they're going to be able to put a hat on and look at you from the outside view and be able to put something together for you. Mm-hmm. So you can't ever do it yourself. But at least if you have IBS or these other underlying symptoms, you can now finally know that there is potentially something bigger going on.
Absolutely. So there's a few SIBO specific diets. So we have one called the specific carbohydrate diet, mm-hmm. gut and psychology syndrome diet. That one's more often referred to as GAPS. Mm-hmm. Then we have the low FODMAP diet, cedar cyanide low fermentation diet, and the SIBO specific food guide. And mm-hmm. all of these it's going to target and reduce carbohydrates. So there's a couple of different ways. When you hear all these different diets, you're probably thinking, okay, well, how do I know which one that I actually want to go with? So with the specific carbohydrate diet, this would be moderate SBO or SIBO, not SBO, moderate SIBO, or number 2 would be IBD, celiac, or diarrheal disease. For GAPS, this is going to be GI issues that coexist with mood and brain disorders. So autism, ADD, depression, anxiety, bipolar, dyslexia, narcolepsy. And then lastly, the SIBO specific food guide. This is going to be severe SIBO. So less foods tolerated and inadequate relief from other diets.
Mm-hmm. Yeah, and the SIBO specific food guide that Casey is referring to is basically just a combination of the specific carbohydrate diet and the low FODMAPs diet. So there's some great websites out there to get resources on more information on the diet. So the specific carbohydrate diet, I know there's a scdlifestyle.com. That's a great website. Breaking the Vicious Cycle is another one. Mm-hmm. And if you haven't read that book, it's a really great book based on Dr. Haas's findings for the specific carbohydrate diet. But anyways, that's just kind of some information where you can look more into them. And then, I guess another website I should mention, which I know we were going to mention later, but I might as well just throw it in now since we're mentioning websites. So you can actually learn a lot of information about SIBO from SIBOinfo.com too.
Mm-hmm.
It's a
Yeah,
good place.
great resource.
Yeah, super great resource. Just wanted to mention it before I forgot.
Hmm.
So, yeah, I mean, basically Casey was mentioning the different diets, and basically what all of those different diets are doing is they are cutting out carbohydrates because bacteria can ferment on any and all carbohydrates, causing distension or bloating. And it's basically just the way these bacteria feed on the carbohydrates, and then it's that methane or carbon dioxide or hydrogen gas that they're producing from eating those foods. So the big issue in SIBO is basically carbohydrates. And it's really all carbohydrates can cause symptoms, right? So anything from grains, even like your starchy vegetables. So I'm talking about like sweet potatoes, peas, corn, cassava, all that kind of stuff. Fruit, even definitely like your nuts, seeds, beans, and most for sure sugar. If you're eating processed sugar, you most definitely want to cut that out of the diet. But even simple sugars like too much fruit or like these complex carbohydrates that are disaccharides, so double chain sugar molecule type foods, you want to cut those out too. So that's more what like the specific carbohydrate in those other diets are doing. And then definitely including, milk, sugar, lactose, and those gag sugars from cartilage, skin, bones, and even broth. Some people you have to be really careful with. And, some for some people, stuff like, bone broths and stuff like that can be very healing and soothing for the intestinal lining, but for others it causes a lot of issues. So this is where that whole bio-individual comes into play, and where your nutritional therapy or functional medicine practitioner really has to work with you on the foods that are going to work for you individually as a person. And then basically the safest thing that you can do for a specific carbohydrate diet is protein and fat.
Yeah, very, very interesting. So, a couple of the diet tips that we have if you are following a SIBO diet is to avoid raw food and salad. You want to choose low FODMAP fruit and veggies. Avoid whole grains and beans, and also, be careful with nuts and seeds.
Mm-hmm.
Starch may be tolerated, so white rice, white potato, white wheat if gluten is tolerated, but often one of these is tolerated, but not another. Lactose-free dairy is often well tolerated. Sugar and clover honey are often well tolerated unless there is yeast, and the amount matters. So small amounts of individual foods may be tolerated when larger amounts are not.
Mm-hmm. And then the one thing that I just have to touch on, because I know, starch may be tolerated, and like your non-gluten starches are always definitely the way to go.
Mhm.
So, your like white wheat, stuff like that, if gluten is tolerated, then that's great. But we also have to keep in mind that with SIBO, we're looking at leaky gut syndrome or just leaky small intestine, your small intestine. So what does gluten do? Gluten is inflammatory and it causes increased permeability in the intestinal lining. So if you're looking at IBS, SIBO, leaky gut, any inflammation, stay away from gluten.
Mm-hmm.
Most
Absolutely.
definitely. So after we kind of figure out and play around with the diet for a little bit, that's when we get into the treatments. So as nutritional therapy practitioners and functional medicine practitioners, we obviously do not prescribe or recommend prescription medications. So we do everything naturally with all natural supplements and herbs. So some big herbal supplements and treatment protocols for SIBO, we incorporate, things like alicillin, which alicillin is just a part of the garlic, not the whole entire clove. So it's actually a specific piece of the garlic from inside. How they extract it, I'm not exactly too sure, but it's an extraction from the whole garlic clove. And then the garlic alicillin is also great for use in methane-based SIBO. And then also other things like berberine herbs, your neems, your oregano, your cinnamon. These are all great herbal treatment supplements and ingredients.
So the protocol would typically be a duration of 4 to 6 weeks, with the basic approach being, if you were with the methane, you would want the alicillin, That's a hard word to say.
Allicin.
Yeah,
I,
Allison.
I think I said Allison earlier, but I messed up. Allison. Sorry.
That's a tough one.
Sorry.
And then,
Allie.
so for hydrogen, that could be your berberine, oregano, neem, cinnamon. And then if you're mixed with the hydrogen and the methane, then you're going to want to mix the allicin and berberine.
Yep.
And so there's always going to be a die-off reaction, which is why it's important to know if you have methane or hydrogen-based SIBO. So you can treat accordingly with specific herbs and gradually increase the protocol doses versus starting off too hard with too much. So I guess kind of the way to say that, like, we would rather be progressive rather than aggressive with it. Like, we can always add more, but we don't want to be overly aggressive at first. And
Exactly. Yeah. That's a perfect way to explain it.
that's the way I used to explain chemical peels.
Ooh, I like it. Coming in handy. Yeah, I mean, you definitely don't want to start just overdoing it because you're like, I got to kill all this bacteria and win the war, and you're taking too much, and then your die-off reaction can be pretty painful. SIBO die-off reactions, it's basically all the symptoms that you're dealing with, right? So fatigue, joints hurt, diarrhea, constipation, gas, bloating. A lot of those symptoms get a lot worse for a period of time. Sometimes, for a week to 3 weeks, even when you're doing a SIBO treatment protocol, I should say. So it's a good thing to be aware of. You also just, don't want to lose hope and don't want to give up. You just got to push through it. But that's why you also want to start slowly and progress or titrate your way up. That way you don't start and your symptoms just get so hard to handle.
Yeah, it's definitely one of those things you don't want to. If 2 is good, 4 is not better.
Yeah. Yeah. So we'll get from 2 to 4, but it'll just take some time.
Mm-hmm.
So most definitely. That's why it's just so important to work with someone that can guide you on that path and through that protocol.
Mm-hmm. Talk you off the ledge.
Pretty much. Yeah. I mean, definitely when people get super uncomfortable, they just want to throw their hands up in the air and stop everything.
Mm-hmm.
And that is like the worst thing that you can do. We can back everything down. We can get you back to a good baseline, but you don't want to just give up because there, definitely is a battle to be won against these bacterias that are overgrown, and it's definitely doable. So you just got to keep up with it and fight through it. And I think we're also making it sound a little bit worse than it is, but it can be, the die-off can be bad. So
yeah, it can be.
Yeah.
All right, so let's do a little recap here of some of the treatment points for a successful SIBO treatment.
Yeah, well, so I mean, number one is get tested, right?
Mm-hmm.
You've got to do that some people argue 4-hour lactulose breath test to figure out if you're dealing with hydrogen or methane, SIBO. And then basically it's just successive treatment rounds as needed, right, with herbal supplements, as well as incorporating the diet. So the diet is a big piece because a lot of times people will start off with a specific carbohydrate diet and they're doing better, but they're not doing great. So then you have to move them over towards more of like a low FODMAP diet, and then they're doing a little bit better, but not great. So then sometimes you have to do a combination of both, right? Or you just have to do like a GAPS. I mean, you just got to play with the diet and you got to figure out what works for you and what foods make you feel good and what foods don't. So that's pretty much number one after you do that breath test. Even while you're waiting for those results, you could get started on the diet protocol.
Mm-hmm.
And then incorporating those herbal supplements once you figure out what exactly you're dealing with, right? Because you got to keep in mind that those methane and or like constipation cases are harder to treat. They just naturally are. So once you get the results back and you figure out if you're dealing with methane or hydrogen, so that's when you get into the different treatments needed per, whatever base of SIBO you're dealing with. Because there are different treatments needed for the methane and or constipation or the hydrogen. And then, of course, you've just got to be prepared for that die-off because die-off is common. And, we as NTPs or your functional practitioner, whoever is supporting you will support you through that die-off. So just make sure that you stay in really good communication with them. keeping them informed with your symptoms and basically how things continue to change. It's really important for them to know, that way they can give you optimal, proper care, and they can just kind of guide you and make changes as needed. So don't ever go 2 weeks with something going on and you're like, oh my gosh, I just can't handle this. Like, definitely reach out and let your practitioner know what's going on so that they can change things as they need to. And then just always keep in mind that treatments vary per person, right? So we talk about like the bio individuality of every single person out there. So, my diet and my herbal treatment is going to be way different from Casey's if we were both sitting here with SIBO. So that's also why it's really important to work with someone. And then the last thing of kind of that whole process is basically just to retest. So once you've gone through your herbal treatments, your protocols, you've been doing the diet 4 to 6 weeks, maybe 8, maybe a little bit longer, maybe got to go through 2 rounds, maybe at the worst case 3 rounds. And then you always want to give a little bit for your body to kind of relax and chill and heal your intestinal lining, and then retest. That way you can assess the results and see where your body's at and see just kind of where your baseline is, and then move forward from there.
Awesome.
Yeah.
All right. So again, places that you can, or a great resource is going to be SIBOinfo.com. So that's just SIBO info.com.
Mm-hmm.
And then you can also schedule a free consultation with Megan on her website, megangump.com, or you can email me, Casey, at info@caseypo.com. And you can work closely with either one of us on a specific SIBO protocol for you. Since everyone is different, we are all bio-individual. Testing is important to know what kind of SIBO we are dealing with and to come up with an individualized treatment plan for you.
Exactly. Yeah, so we hope that you guys enjoyed today's show. Thank you so much for listening. And like Casey said, if you're interested in working with either one of us, you can work further with me, Megan, and also Casey. And then just to learn more, as Casey mentioned, Megan, can be found online at megangump.com. And you can actually go on my website and book a free 15-minute introductory phone call on my website to learn more about working with me. And then you can also just find and follow me on Instagram to see what I'm up to and get some helpful tidbit tips from there. And my Instagram handle is just at megan.gump.
And you can find me, Casey Poe Campbell, at caseypoe.com or on Instagram at Real Talk Casey. You will see lots of Jade Roller this week. So we will see you guys there. Thank you so much for tuning in, and have a great day.